Dr. Quinn, are you seeing more patients who are suffering from depression and anxiety during this pandemic?
Andrew, during this pandemic, the world is seeing more patients suffering from severe anxiety and depression. I mean, just recently, the United States Census Bureau put out a report. It was noted that 1 in 3 Americans are suffering right now from clinical depression and anxiety, which is much more than before the pandemic. Other medical organizations are making it as well, such as the American Medical Association that just put out a report that said during the pandemic, we have 3 times the chance of having depression as opposed to the pandemic. But even here at my clinic here in Jackson, I'm having so many patients to come in with anxiety and depression. I'm having to prescribe medication. Some I'm having to for counseling, and then some I'm even having to take off work because depression and anxiety is so great.
Doc, recently former Mississippi State quarterback Dak Prescott shared his story about dealing with depression. How important is it for celebrities to come forward like Dak did?
I mean, it is very, very helpful. And basically, it's been identified that one of the #1 problems or the obstacles for people to come forward is negative stigma associated with this condition. And with celebrities, when they come forward and share, it sort of dispels this stigma. Like, for instance, when Dak Prescott came, he's a well-respected African-American male who's an NFL quarterback. And a lot of people saw him and shared that he was suffering and got help. And it's a lot of different groups to include African-American males, which is a very vulnerable group, which I'm a part of myself. And when we see someone like Dak Prescott come forward and say, hey, I've had depression, anxiety, I'm help, getting better, it makes it so that there's a much higher probability someone like me will come forward if we are having depression, and we don't fear that we're less than a man, or weak, and we'll get the help we need, possibly save our lives.
Dr. Quinn, what is the next step when somebody does get that diagnosis of being depressed or having anxiety? What are the next steps to go to help that person get on that road to recovery?
Well, the most important thing is we as medical providers, we're being highly encouraged to engage our patients, ask them how they're feeling, even if they come in for a blood pressure check, and inquire about signs and symptoms that they may have some depression or. And if they do, engage more and provide the therapy they need so that they can get better and possibly save a lot of people's lives.
All right, Dr. Timothy Quinn, thanks for taking a few minutes with us this afternoon.
Thank you.
You're watching 12 News at Noon.